Good afternoon, everyone. My name is Josh Berry, and I have the pleasure to be joined today by my colleague Megan Jordan at NACCHO, who is my co-host for this webinar. I work with the Association of State and Territorial Health Officials, where I'm an analyst of health promotion and disease prevention. In support of Through with Chew Week and the Great American Spit Out, I am very excited and looking forward to the rich information that will be shared on today's webinar, Opportunities for State and Local Health Departments to Address Smokeless Tobacco Control in Rural Populations.
Thank you, Josh. My name is Megan Jordan. I work with the National Association of County and City Health Officials, where I serve as the Director of Community Health Promotion. Within my portfolio, we focus on chronic disease prevention and tobacco prevention, and we welcome you all to today's interactive webinar.
Thank you, Megan. As you all can see, we have a full agenda to cover today with a number of state and local speakers, and we also have a number of meeting objectives. And so our goals on today's webinar are to learn about the unique challenges posed by smokeless and combustible tobacco use in rural communities, to discuss examples of campaigns and programs receptive in rural communities to reduce smokeless tobacco use, and to explore the collaboration between state and local health departments to implement successful tobacco control initiatives in rural areas. ASTHO is the national nonprofit organization representing public health agencies in the United States, the U.S. territories, and the District of Columbia, and over 100,000 public health professionals these agencies employ. ASTHO members, the chief health officials of these jurisdictions, formulate and influence sound public health policy and ensure excellence in state-based public health practice. ASTHO's primary function is to track, evaluate, and advise members on the impact and formulation of private health policy which may affect them, and to provide them with guidance and technical assistance on improving the nation's health.
The National Association of County and City Health Officials, known as NACCHO, is the voice of approximately 2,800 local health departments across the country. These city, county, metropolitan, district, and tribal departments work to protect and improve the health of all people and all communities. NACCHO provides resources to help these local health department leaders develop public health policies and programs to ensure that communities have access to the vital programs and services people need to keep them protected from disease and disaster. Additionally, NACCHO advocates on behalf of local health departments with federal policymakers for adequate resources, appropriate public health legislation, and sensible policies to address the myriad of challenges facing communities.
Thank you, Megan. And so a quick note on webinar logistics before we get started. All phone lines for participants have been muted during this webinar. So please plan to use your computer speakers or your phone, but not both, to listen in to today's webinar. If you have a question for our webinar presenters, please post it into the chat box on your screen at any time. These questions will be used during the Q&A portion following today's state and local presentations. A recording of today's webinar will be posted on the NACCHO and ASTHO websites within 2 weeks. The addresses to these websites will be available at the end of this webinar. Following the conclusion of the webinar, you will be automatically directed to an evaluation survey. Please take a few minutes to provide your feedback. We look forward to receiving your comments about today's webinar.
So joining us first on today's webinar is Kristen Kirchenbauer and Jonna Sue Blair from Oklahoma. Kristen started working in tobacco control at the Oklahoma State Department of Health Center for the Advancement of Wellness Division in 2013. Kristen was hired as the Cessations Systems Coordinator and is currently serving as the Interim Tobacco Manager. Jonna Sue Blair is a Wellness Coordinator at Wagner County Health Department. She works in the Tobacco Settlement Endowment Trust, TSET, Healthy Living Program. Their mission is to create a healthier Wagner County by increasing physical activity opportunities, access to nutritious food, and tobacco-free environments across sectors where people live, work, play, pray, and learn. Kristen and Jonna Sue, the floor is yours.
Thank you so much for that introduction. As she stated, I am Kristen Kirchenbauer, the Interim Tobacco Manager for the Oklahoma State Department of Health. And I'm going to start out the presentation giving you a high-level overview of the state tobacco control initiatives that we work on. And then later in the presentation, Sue will get down into the nitty-gritty and give you a more local perspective of the community work that is happening in Oklahoma. So the Oklahoma State Department of Health oversees all of the statewide tobacco control efforts. And what makes Oklahoma unique is the fact that we decided to put our master settlement funds into a trust and then utilize that money to fund community initiatives, specifically focusing on tobacco control efforts and obesity efforts. So the Tobacco Settlement Endowment Trust, often referred to as TSET, has had 2 iterations of the community grants focused on these on tobacco control and obesity. Right now, the Healthy Living Program was enacted in 2015, and they fund over 50 community grants covering 63 counties. So Sue will discuss this in detail later in the presentation. Oops, I forgot to advance the slides. So the first slide I wanted to show you is our stats for smoking prevalence among youth. And the reason I wanted to highlight this is because Oklahoma has done a really good job of reducing the prevalence of smoking. We've seen an increase in e-cigarette use. But what you'll see with the next slide is that we've had a little bit more difficulty reducing smokeless prevalence among youth. And what you'll notice is that we are considerably higher than the U.S. And for high school students in the U.S., the prevalence is 6.0 and we're at 10.2. And for middle school, it's 1.8 for the U.S. and we're at 4.3. So we haven't seen as steady declines for smokeless, and I think that with the grantees and then the work that we're doing at a state level, we are focused on trying to get those rates to go down as well as what we've seen with our cigarette prevalence. The next is our adult smokeless tobacco use from Burfus. And again, you'll see we are above the United States prevalence at 6.7. So one of the main things that we focus on are our statewide media campaigns. And the Tobacco Settlement Endowment Trust oversees the majority of the media efforts that occur in Oklahoma. The 2 biggest campaigns are the Tobacco Stops With Me and the Oklahoma Tobacco Helpline campaign. The main purpose of the Tobacco Stops With Me is it's providing a recognizable tobacco-free messages for all Oklahomans, and we're primarily concerned with educating the public about the negative effects of tobacco, and the main goal is to prevent and reduce tobacco use. The messages are intended to resonate with all people, and we're specifically focusing on children and young adults, and we hope to encourage positive changes through our media messages. The Oklahoma Tobacco Helpline campaign is modeled after the Clearway, Minnesota campaign, No Judgments, Just Help. We use print, radio, TV, and social media are the venues that we use for both of those campaigns. So this is an example of the new messaging for the Oklahoma Tobacco Helpline. It's No Judgments, Just Help. This is actually taken from our Facebook page. I wanted to highlight a smokeless tobacco media campaign that has occurred in Oklahoma. So TSET started this smokeless media campaign with the main goal of increasing calls to the helpline from males and increase awareness of the helpline from family and friends of smokeless users. We ran targeted ads focused on smokeless users, mainly men in rural low SES communities. We used local print, outdoor placement, radio, country stations mainly, and then broadcast and cable TV and some live sporting events. I did have a slide that was going to highlight a storytelling from James Capps. He's a native Oklahoma, a rancher, a husband, father, and he actually was a former smokeless user. He was diagnosed with oral cancer, and the video really captures his personal testimony. And I believe that Josh will be sending out the link after the webinar since we couldn't play it on this one, but I think it does a really good job of really highlighting the stereotypes that we often have and I'm a cowboy, this is what we do, this is our culture, and this is, you know, how we live. And he does a really good job, and it resonated with a lot of our Oklahomans that do use smokeless tobacco. So there's that link. We also developed some creative materials that we still use, specifically aimed at smokeless tobacco. These also had a good, resonated well with our rural health, or I'm sorry, our rural populations. So from this, we evaluated the smokeless tobacco media campaign, and what we recognized and noticed that there was a 265% increase in utilization of the helpline in the first 2 weeks. So we went from 95 to 124. We also saw an increase in males trying to quit, and our volume went up 51%. So it was very successful. So we continue on with our social media efforts specific to smokeless tobacco. This was actually posted yesterday on our Facebook page, and then I was on there today as well, and there was another one. So we try to continually focus our messaging around smokeless tobacco and other venues. I wanted to also highlight some of the cessation initiatives that have really impacted our rates and have had an impact on smokeless tobacco users. So Oklahoma focuses on health systems. So the TSET funds the Health Systems Initiative grantees. And these folks focus on health systems change within focus organizations, for example, hospitals, mental health and substance use facilities, and then Medicaid funded providers. And we have seen a great impact with direct referrals from these folks. As you can see in FY16, there were over 10,000 fax referrals and 2,000 electronic referrals. We also try to focus on disproportionately affected individuals that are affected with tobacco dependence, and we use a tribal cessation work group to really focus on that. We've seen an increase in utilization among American Indians as well. So our OTH successes, which is the Oklahoma Tobacco Helpline, specific to smokeless, we've seen huge increases from comparing FY15 to FY16. So in FY16, there were 2,300 smokeless tobacco users, and that represents a 47% increase when we compare to FY15. And I think one thing that we're really proud of is that we're seeing our treatment reach increase as well. So in 2015, FY15, the treatment reach was at 0.9, and now it's at 1.3. And I think it's a continued focus for us to get those rates down and to start seeing declines as we have with cigarette smoking. So other statewide efforts regarding prevention, we are starting to do the Standardized Tobacco Assessment for Retail Stores, or STARS. That is focused on cigarettes, but we have an interest in looking at the difference in our rural communities and our rural counties and looking at smokeless and maybe getting some information around advertisement for smokeless tobacco. So that's an initiative we're looking at. We're also looking at revamping our SWAT, so the Students Working Against Tobacco teams. As we were transitioning from the old tobacco control community grants with TSET, those kind of took maybe a little bit of a back seat. So we are ramping up again with the youth advocacy programs to really start focusing on specific products such as smokeless tobacco. So I'm just going to briefly mention this because this is the work that the local grantees work on, the Healthy Living grantees. They work on policy initiatives for these specific sectors. John and Sue will be going over more information regarding these sectors and the policy work that happens at the local level. They have a lot of experience working with their local communities, and she'll probably talk about some of the barriers and things that she's encountered when trying to get some of these policy initiatives passed. But the Oklahoma State Department of Health provides oversight and technical assistance for the local grantees. I wanted to highlight some of the policy efforts that have happened at a state level. I think it's really great what we've done, that some of these policy efforts have incorporated not only cigarettes but smokeless and electronic cigarettes. So the first highlight would be the Embark project. In 2016, the City of Oklahoma City worked through Embark, which is formerly known as our Oklahoma City Metro Transit Authority, to pass a voluntary comprehensive tobacco-free policy. And the interesting thing about this is that it's not just cigarettes, but it includes smokeless and e-cigarettes at all transit stops, shelters, indoor and outdoor facilities, and all the public transit vehicles. So not only does the policy protect their employees, but it impacts the ridership and the public at large. I also think what makes this interesting is it really highlights how we work together with our local community grantees. So Embark partnered with the leading health agencies and then also those local grantees to help develop the policy and then map out an implementation plan. And one of the other interesting things that they did is that they provided cessation resources to their employees and ridership, and they had direct referrals, and there were almost 150% actually accepted services. So we found that that was really, really a success because usually in those situations you don't see very many referrals get accepted. The next policy highlight would be the Oklahoma City Public Housing Authority. So in March 2016, the OKC Public Housing Authority went completely tobacco-free, including smokeless and vape, curb to curb. And to my knowledge, they were the first, and they might be one of the only public housing authorities that have went completely tobacco-free of all tobacco forms, curb to curb. This policy applies to 3,100 units that are owned by the authority. The other thing to highlight is that there was that partnership, again, with the state health agency, the organization, and then that community-based grantee. And so we worked together as well to help implement this and get the resources to their the people who live within the units. The last thing that I wanted to highlight, which I think has made a huge impact on our cigarette prevalence among youth, is the Tobacco-Free Schools law that was put into place. So it's known as the 24/7 Tobacco-Free Schools Act, and it went into effect in August of 2015. And this really was a result of the years of work by local grantees and then statewide support for those tobacco-free schools. When the law was passed, the majority of the schools had already had some sort of tobacco-free policy in place. And I think that a large majority of that work was because of the countless effort from the SWAT teams and the community coalitions and coordinators who really put effort into getting those voluntary policies passed. We believe that the 24/7 tobacco-free policies and eventually the law has had an impact on the youth prevalence over the course of 10 years. And so we really hope that we can start focusing on smokeless to get those prevalence numbers to come down as well. And this next slide just kind of highlights that progression over the years of those voluntary policies being passed. So you can see from 2000 to 2015, all of the work that those coalitions and SWAT members and grantees did to get it to the point where it became state law. So I'm going to hand it over to Jonasue Blair. She is the Healthy Living Coordinator for the Healthy Living Program within Wagner County, and she's going to give a local perspective of working with those rural communities and what it's like to be out in the field working. Jonasue?
Thanks. Hope everyone is having a great day. It's 79 and beautiful here in Oklahoma. My name is Jonasue Blair, and as Kristen said, I work in the TSET, the Tobacco Settlement Endowment Trust Healthy Living Program. Our grant is a policy-driven grant, and we focused on making sustainable changes through policy changes, and that's what we work on. We're very fortunate in Oklahoma because the money allows for the local communities to really drive the decisions. Like, we want to work on this, this is a problem, and then we'll use evidence-based to change things. One of the things we have to concentrate on are different sectors. There's business, cities and government, schools, and community institutions and organizations. Basically what that is that we mainly work with are congregations and daycare centers. Just to show you kind of that I truly am in a rural area, I wanted to just kind of highlight some of the population numbers. Wagner County is a large county, but we've got a lot of small towns. I only put our biggest towns that are in the county. I didn't list all of them. And the city of Wagner has a large minority population. Our county is also primarily in Creek Nation, but we also have a part of our county that's in Cherokee Nation. So we do have partnerships with the tribal nations as well. When working to stop the use of smokeless tobacco, you really have to have a multi-level approach. The reason I say this is my husband is the youngest of 7 children. It was a farming family, and he started dipping when he was 11 years old. To his family, that just wasn't a big deal. He's a boy. That's what boys do, and they all smoke. So when we start educating on tobacco and trying to control tobacco and prevent tobacco, we have to talk to the adults, to the youth, and to the children. And we have to change a way of thinking that's been ingrained in a lot of the rural areas that, you know, that's just what you do, that's the cowboy way, that's what, you know, that's what farmers do. And you've got to use elementary school education, peer-to-peer education in middle and high schools, and then you really need to emphasize positive role modeling to adults. I mean, yes, I want them to quit using, but I don't want to come across as, say, a tobacco Nazi. Because if you're in a small town, you've got to have partnerships. You've got to have people that are going to work with you. And I understand, and many people understand, the struggles of tobacco use. But what you want to stress is that as a parent, you don't want your children to pick up that habit. If they don't start, then they don't have to quit. And that's one of the things when I go out and I'm doing education at daycare centers for parent meetings, Head Starts. That's one of the things we talk about is, you know, positive role model. You want your children to be healthy. You want them to eat better, and you don't want them to pick up the tobacco habit. On Students Working Against Tobacco, great program. We have 5 teams in our county. We have 3 middle school teams and 2 high school teams. As a matter of fact, James Capps that Kristen was talking about, that's how they found him. His daughter was a SWAT member, and she was telling her sponsor about it. That got back to the local grantee. The grantee, it became a huge, very effective campaign, all because this girl was talking about her dad who had had oral cancer. The primary purpose of SWAT is to educate their peers on the deceptive practices of big tobacco. And they talk about how big tobacco targets them as replacement users. So it's really about educating their peers, trying to get them from never picking it up. SWAT helped drive 24/7 tobacco-free schools. Every school in Wagner County before it became a law was tobacco-free 24/7. And about 3 years ago, the Porter High School SWAT team, they really worked with me to advocate on getting a tobacco-free, vape-free municipal property ordinance in the town of Porter. Those high school students went to the town council meeting. They stood up in front of these council members, and they talked about how it was important to them that these parks in their town be tobacco-free, that they didn't want the young kids in their town exposed to secondhand smoke or to view people using tobacco. If you've got a young person that cares enough to stand up in front of 5 town council people, those adults are going to listen because it takes a lot of bravery and they have a lot of passion when they talk. When talking about smokeless tobacco, I think the biggest obstacle that we run across is enforcement. I've been working for 4 years now on trying to get the city of Coweta to adopt a tobacco-free municipal ordinance, and I just can't get past they say they can't enforce it. Now, the city of Wagner and the town of Porter have both passed these ordinances. We've actually had very good luck with them. The police force is on board. The sheriff's office is on board. Yes, you can get a ticket, but for the most part, we're just using passive, please put out your cigarette. But that's what I hear. Right now, the Coweta Junior High SWAT team and TSET staff, we are in the process of collecting surveys at school sporting events and at other local events to get local opinions on tobacco-free environments and other healthy living initiatives. And we're trying to gather data to show council members that this is what your voters want. Your voters want tobacco-free environments. And the same thing as I said earlier, when I'm talking to city council members and I'm talking to the city manager, I'm not vilifying smokeless or tobacco use. I'm talking about being positive role model to the children. You know, I'm not asking you to quit, but when you're coaching your son's baseball team, can you leave it in the truck is basically what we're trying to get by with. From personal stories, you know, a young child idolizes their coach. If they see their coach dipping, then they think they want to. And I've heard the stories. I've got relatives and I've got friends. They say the first time they tried it, they threw up. But coach is dipping. I need to quit. I want to be cool like coach. So that's the kind of stories that we're trying to share with adults to let them know how much they can affect what these children are doing. When it comes to businesses, same kind of deal. When you're working on a worksite policy and includes all their owned vehicles, tobacco, if they're smoking, people tattle real quick, and you can see them. They're in the truck. They've got a cigarette. You're going to be like, hey, man, you know our policy in our business is no tobacco use. It's harder to enforce when we have a smokeless user. I know I'm working with one business right now that we're in the process of creating paycheck stuffers as a reminder. Tobacco means all tobacco. If you're a dip, please, you know, you can't use that when you're on the sorry, I just looked at something and lost my train of thought. When you're on our property, when you're in our vehicles, you can't use tobacco. Another thing that we do, we work with our dentist office, especially this week during Through with Chew. We educate with the dental hygienists, and they're very receptive about talking to their patients about the dangers of smokeless, because I mean they see it quite often, but we just kind of focus this week on contacting them. We also have a really good relationship with the federally qualified health center in our county. In fact, Kristen and the staff at the state health department, they came down and led a training on tobacco education and the Oklahoma Tobacco Helpline, and to help them be able to talk to, and that is mainly a low socioeconomic status clinic, to reach out to a portion of the population that's difficult to get to. Another thing that we work with in Wagner County is we work on event policies. For example, there's something called Movies Under the Stars that's in Coweta, and that event is held at a park. Well, the event adopted a tobacco-free policy. So even though that park isn't, their event is. So if you come to Movies Under the Stars, you're not able to use tobacco. You can be asked to leave. And we've had successes with several other events adopting those policies. So it's kind of hopefully making our way in the back door with that city council to try to get them to think about adopting the municipal property ordinance. You know, it's a lot of hard work, and it's slow going. Sometimes you think you're making progress, and then you'll see something that kind of disheartens you a little bit. But I believe it's possible, and I've seen the changes. I mean, we've had a drop in our tobacco use rates in our county since we've been working on this grant, and it really is affecting the social norm. You don't openly see it as much as you used to, and I do hear some really great stories about some farmers in the area that have called the Oklahoma Tobacco Helpline and quit. So excuse me, I hope that this helps some of you, and I am happy to share whatever I need to. Thanks.
Thank you so much, Kristen and Jonathan, for your presentation. Next, we are joined by Vicki Tucker and Jacqueline Carter, together representing the state of Mississippi on today's webinar. Vicki M. Tucker is currently the Division Director for Statewide Interventions within the Mississippi State Department Office of Tobacco Control. She provides administrative oversight for statewide programs and services, including prevention, statewide healthcare provider associations, and cessation treatment services. Jacqueline Carter is currently the Project Director for the Mississippi Tobacco-Free Coalition of Hinds County. She works with communities to provide awareness and education on the harmful effects of tobacco use. She is also instrumental in the development of policy within the communities that she serves. Vicki and Jacqueline, thank you for joining us this afternoon.
Thank you for having us. This is Vicki. I'm going to start first and give sort of an overview for the state and what our smokeless tobacco efforts entail. I'm the Division Director for Statewide Interventions, which includes youth programs, statewide provider groups, and cessation treatment services. This office provides a comprehensive tobacco control program, and the various components implement activities statewide. Being a rural state, we contend with a significant amount of smokeless tobacco prevalence. Our state data findings are that Caucasian males are more likely than any other groups to have tried smokeless tobacco, and they, of course, have the highest utilization rates among smokeless tobacco users. However, that does not mean that they are the only smokeless tobacco users who utilize tobacco at high rates. So to address usage rates, we have implemented awareness and education that is included in all of our presentations and trainings as provided by the Office of Tobacco Control and any of our sub-grantees. Our state quit line has a specialized protocol for smokeless tobacco users, and in order to assist us in addressing these rates throughout the state, we have partnered with the Rescue Social Change Group. The Rescue Social Change Group is a behavior change agency. They provide comprehensive behavior change marketing programs through a method that they refer to as peer science, peer, P-E-E-R science. Through this process, the target audience is segmented into peer crowds, which are the macro-level connections between peer groups with similar interests, lifestyles, influences, and habits. Then, based on the values of those groups, their habits and or challenges that drive unhealthy behavior, there's an effort to change policy, knowledge, and the culture. So here in Mississippi, our target segment has been identified as what is labeled as country teens. And country teens don't necessarily live in the country. They could be from the suburbs, but country teens encompasses their lifestyle. Activities to support that lifestyle might include hunting, fishing, mud riding, the rodeo circuit, and other outdoor type activities. And within that country teen culture, there are also some other subcultures who may not necessarily identify as country teens, but they engage in some of the country activities. So in working with Rescue Social Change Group, they brought that awareness to us, and they promote the brand with this country teen culture called Down and Dirty. On this slide, you will see that Rescue's approach is done via media activities. Again, the campaign is called Down and Dirty. The brand recognition and the brand messages are carried out through social media outlets such as Facebook, Instagram, and YouTube. And one thing that we found is that typically you hear people say that Facebook is for the older social media users, but what we found in working with the country teens is that they still utilize Facebook. And actually, Facebook was the most utilized medium that they used. We also use YouTube to promote the 4 media packages that we disseminate during the year. We have 4 media packages that we do. The ones that we've done so far for this fiscal year is the first one was called Built Up, and it focuses on activities that youth can do to build themselves up in contrast with how tobacco or spit tobacco use pulls them down. The second package was called Hack It, and it focuses on hacks like putting a pool liner in the back of a pickup truck and making a swimming pool out of it, duct taping a broken side view mirror to your truck, and some other anecdotal type things that they use in the media. But the message was, there are hacks, but for dip, there is no fix. The third one was called Cash Out on Dip. Chewing tobacco cost takes away from living the desired country lifestyle for this teen population. So if you're utilizing smokeless tobacco, you're cashing out. You're spending your money on tobacco instead of things that you could really enhance your lifestyle with. And the very last package for this fiscal year is called Country Sense, and the play on words was common sense. And what this ad focused on was what should be common sense as it relates to using spit tobacco products. And it gave examples of a youth driving his pickup truck, and there was a barrier in the middle of the road, and it had nails sticking up in it. And the terminology was common sense. Would you drive over this bed of nails if you saw it in the middle of the road? And they compared that to, like, no, that's a stupid decision. And they compared it to using spit tobacco, which is equally not a smart choice. So the play on word, again, was common sense. Some of the other activities that Rescue does for Mississippi is they participate in 12 sponsored events per year. And those events, of course, are centered around country teen activities like the rodeo, the bull riding events, the state fair, the wildlife extravaganza, crawfish boils, and other events that are in line with the country lifestyle. They do one per month, a minimum of one per month. There have been some months when they have done more than one, but typically it's 12 per year. And during these events, they have brand ambassadors to engage the youth. These brand ambassadors, they interact with the crowd, deliver interactive messaging, and when they have youth to come up to their exhibit table, they collect information cards with name and contact information. So these cards are used for further engagement. If those youth are interested in becoming brand ambassadors themselves, then Rescue will draw from that pool of youth and training up the next set of brand ambassadors. This information is also going to be used by the Office of Tobacco Control and our third-party evaluators to conduct focus groups to determine the level of effectiveness of the brand messaging for the youth who have attended these events, and to take a look at any resulting behavior change as part of event attendance. Some of the other types of feedback that we get from Rescue is on reach, and that's the number of people who actually saw any content about the page and whether or not these people were reached through a viral post or through a paid channel. We get feedback on the number of impressions, which is the number of times a post from a page is displayed or seen, and whether or not it is clicked during the message package. And we get information on engagement. And engagement is the total number of comments, likes, shares, posts, photo views, or other social actions that are received as a result of the message package. Even though Down and Dirty is our primary mode of media activities to support our smokeless efforts, there is also Smokeless Activity that is sponsored by this office. This is done through stakeholders, sub-grantees, State Department of Health district staff, and our Mississippi Tobacco Free Coalition. The State Department of Health district level staff consists of a community health director, a preventive health nurse, and health educators, one of each in each of the 9 public health districts. We refer to this group as our district prevention team. They are actually new to the agency, and they're a part of our transformation to prevention versus our old service scale, which was based on treatment. But they are actually getting oriented to everything that the agency has to offer. They're attending training. They've been introduced to our stakeholders and partners and other organizations that we work with, such as our Mississippi Tobacco Free Coalition directors, who work in the field, and they do activities around smokeless tobacco as well as other tobacco issues. But during this transition phase, the district-level staff are working closely with our MTFCs, which is our Mississippi Tobacco Free Coalitions, to gain knowledge and basically collect information and data around our tobacco control efforts. They have a pretty intense schedule for this first year, and they're just working to get up to speed at this point. But once they have completed all of their prescribed trainings, they will begin to work at the district health department level to implement smokeless activities as well as other tobacco control efforts. I can say that they have already begun working and attending some of the awareness and educational events that have been conducted by our MTFCs, and they have even assisted in scheduling and conducting these events. Throughout my slides, you've heard me refer to the MTFCs, so I'll give you a little background into what the coalition work consists of. Throughout the state, we have a total of 34 MTFC directors. Collectively, each of these directors cover all 82 counties in Mississippi. They have an extensive scope of work that is prescribed by the Office of Tobacco Control that includes activities around prevention, secondhand smoke, cessation and disparity elimination, and of course policy to support all of these activities and efforts. But beyond their scopes of work, they have relationships and networks within the communities that they serve that assist them in carrying out their deliverables, and also in assisting those networks that they partner with to help them develop and carry out their priorities. So they actually go above and beyond and do a lot of work that is not directly, directed by OTC, but it helps them in building relationships and carrying out their scope. So today on the call, we have one of our Mississippi Tobacco Free Coalition directors from the central Mississippi area, and she covers Hinds County, and she will talk about the work that she has done and is doing around spit tobacco. So, Jackie, I will let you take it from here.
Thank you, Vicki. It's such a pleasure to be here on the call today. At the local level, as a Mississippi Tobacco Free Coalition director, we see a number of opportunities, and every chance that we have to take upon those opportunities to educate about smokeless tobacco, we take those opportunities very seriously. One of those opportunities at the local level, we've had work with colleges and universities. One college in particular here was a very prestigious college here in the Clinton, Mississippi area, where efforts started with me as a director working with HR, also working with upper management to make sure that in those policies, when they start forming and transitioning those policies, they make sure that they are including smokeless tobacco and all other types of tobacco as well. That was a success. That was a college that was very glad to have our guidance, very glad to have our policy knowledge to back them up, and also very glad to know about all the cessation services that was offered to the staff members as well, because that way they did not have to go outside to another agency. They were still able to take on the partnership right with us. So that worked out well in opportunities to have the smokeless tobacco in their policies on their side of the college with that particular example. Also, other examples, we work with different colleges and universities, and in my area, we have over 10 colleges and universities, and at every chance, I always sit at the table and tell them that we have to make sure that this is a comprehensive tobacco-free policy so that we can include all types of tobacco, also very much including all smokeless tobacco. Another opportunity at the local level are working with the mayors and city officials to have a smoke-free ordinance in their towns. There are some towns who sometimes already have an ordinance in their town, and a lot of times they're not there. But when they do ask for our help at the local level, we definitely are glad to hear that, because what happens is when they get started with those policies, at that particular moment, we make sure that we're mentioning every vaping shop, every e-cigarette opportunity, and every smokeless tobacco opportunity to make sure that this is a very comprehensive ordinance and policy. This was a unique opportunity here in my county where policy effort was with the local schools. This was Kick Butt Day 2016, which was last year. Those students were so excited to go outside and to pick up the litter, the cigarette litter, and paraphernalia around their schools. The principal told us when we first started, oh, you're not going to find any tobacco paraphernalia around this school. We do a great job of keeping everything clean around the school. And I said, well, okay, we just want to do a survey of it with this particular activity that we had, and it was very, very eye-opening. When we finished collecting, this was a teachable moment here at this particular high school, because one student found a school paraphernalia that was there, and he was like, oh, well, this is not a tobacco product, right? My brother does this, so this is not a tobacco product. And to his surprise, I had to educate him at that particular moment and let him know that that was a smokeless tobacco product. And there was a product that not only just had some nicotine ingredients in it, it had double nicotine ingredients because of it being a smokeless tobacco product. So it worked out great. In the end, the principal we found 229 pieces of tobacco litter at the school, and the kids were so excited in the end because they were bringing all of their different cigarette butts and all the different paraphernalia from the cigarette tobacco products. And this was an awesome, teachable moment right at that particular day, talking about smokeless tobacco and the dangers of tobacco use. We also have great opportunities with the Mississippi High School Activities Association, where we're involved in the soccer games, when they have the track meets, when they're having football games or baseball games, the tennis meets, all those opportunities that we have at that particular moment to talk one-on-one with the parents and also to talk one-on-one with the counselors and the schools that attend those different schools about smokeless tobacco, about the dangers of tobacco use. That is a great, great outreach opportunity that we all as directors here in Mississippi take very seriously. The other opportunity is the Mississippi Association of Coaches, where they have a conference once a year, twice a year. And as a project director, you definitely want to be at the table with those coaches because they influence players very much. And we want to be at the table to influence those coaches, to influence those students, the dangers of chewing tobacco. Because what we found is that some of those activities that they're participating in, those coaches enable those students to have those smokeless tobacco products. So in knowing that, we definitely take an aggressive effort to make sure that we're at the table with the Mississippi Association of Coaches and to teach them the dangers that it has on the body and also the teeth. And there have been cases where the students have said, oh, yes, I had to get some teeth replaced, or I had to do a lot of expensive gum work because of that. And we are so, so happy to have those opportunities to get to the table at those conferences with the Mississippi Association of Coaches. Also, the opportunities of vacation Bible schools, an unusual opportunity, but a great opportunity for those that may be homeschooled, with those that attend public private schools or charter schools. We can capture their audience right then, and we can educate them about the smokeless tobacco. Policy efforts take place all over the state of Mississippi, and we take much pride in making sure that at the table, when we're talking with our city officials or talking with a mayor or a council person, we make sure that when they start off with their policies, we want to make sure that it's very much comprehensive to include all tobacco products, specifying what those products are, including the spit tobacco and the chew tobacco, the vaping products, and the electronic cigarettes. That's a great way of making policy change at the table before they even get into any other talks in the town, that is a priority that's on the table. And also my last example I want to present to you is when we go out to the multi-housing units, where we have the elderly sometimes that are there, or the disabled that are there. And sometimes they may not understand what their policies are, but we go out and we make sure that they have surveys and they understand what all types of tobacco products are and what they're using and what's not allowed in those particular multi-housing units. And those managers, they definitely appreciate the support and the partnership that we have. So we take all of our opportunities that we have to educate at every point, at every school, at every vacation Bible school, at every faith-based organization, even with the businesses. There's a business now that I'm working with wanting to go tobacco-free and have a comprehensive policy, and they're working with HR, myself, and the cessation program here in Mississippi. So that's a great way to start off having a comprehensive policy that involves the smokeless tobacco. I hear that with the strategy is real harsh on this and that. And as in conclusion, I want to also include that we work with the rural communities here that carry in Ellis, Mississippi. And some of those rural areas don't even have get over the strategy here on this side. In conclusion, I definitely want to make sure that our efforts on this end in the rural communities are so important, because they don't even have grocery stores, but they have convenience stores where they're able to go and to buy the smokeless tobacco and all the tobacco products. But we're still standing with those communities and educating at every opportunity that we have here in Mississippi. And I thank you.
Well, thank you so much, Vicki and Jacqueline, for your presentations. I really appreciate your time in joining us this afternoon. Now it's time for us to move on to the Q&A session of our webinar. And so I would like to say as a reminder to everybody, if you'd like to ask a question during the Q&A time, you are able to use the chat box on your screen. Phones are muted for participants for the duration of this webinar. And so if you have any follow-up questions that you would like to pose to our speakers, feel free to use the chat box for that. And so I would like to start off actually by addressing a logistics question that we've seen coming in a couple times, asking if slides and or recording of the webinar will be made available, and the answer is definitely yes. We will be following up later this week via email with a copy of slides and then also a full webinar recording. And then in addition, we'll also be posting those resources on the ASTHO and NACCHO websites. And Megan and I will have the opportunity to let you all know where you can find those resources as we conclude this afternoon. And so moving on to questions that we have received in the chat box so far, I'd like to pose a question directed at Oklahoma to Kristen, and then perhaps to Jonna Sue if she has anything to add as well. Has the Oklahoma tobacco program had to navigate any preemptive language that could keep local governments from regulating outdoor tobacco use or smoking? Kristen, do you have any insights on that?
We actually do, because we are preempted. So we actually have a law, an executive order from the governor for all state property to be tobacco free. So that allows city ordinances to basically mimic the state executive order or state law for state property. So their city-owned property can be tobacco free. So that's kind of how we've gotten around our preemption language. The voluntary policies have been helpful as well for some of the other ones, and then the parks have also been able to go around that being city-owned. So yes, it's been difficult, but that governor's executive order has given us some wiggle room and allowed for that. The voluntary policies have been very beneficial as well. And then, as I stated, with the school, the governor actually signed that into law as well from all of that voluntary policy passage that we had going on for the last 10 years, it finally made the case to actually get a law in place.
Great. Thanks so much, Kristen. And Jonathan, do you have anything to add from your more local perspective as to how preemption impacts the policy landscape available to you at the local level?
I mean, it does make it difficult when we are trying to pass certain ordinances, but you know, you have to work with it because that's what you have. So.
Sure, understood. Yeah, thanks so much. So we have another question coming in. What is your e-cigarette and vaping rate in your state? And this person is telling us, in our district, cigarette usage rate is stagnating at 11%, but e-cigarette and vaping usage is at 18%, and that's certainly something that probably many folks all over the country are seeing in their numbers. Vicki and Jacqueline, do you have any insights as to what your e-cigarette usage rates are in Mississippi?
Hey, this is Vicki. I don't have the rates here at hand. I do know that we have seen an increase in e-cigarette use here among our youth population and adult population as well. But I can definitely get that information to the facilitators so that we can get it out to the group.
Sure, that sounds fine. And then I do want to turn things over also to Kristen. I see you have us back at the slide where you briefly went over that. Can you walk us through this information here?
So we're definitely monitoring our youth. We see an increase in adults as well, but we're really interested in youth because we are seeing those cigarette prevalence decline, but the e-cigarettes have gone up a lot. So we're at 19%. And I believe the U.S., I have that number, for e-cigarettes, they are, I know, and I didn't get it from her, but I can get it really quickly. I know that we're higher than the U.S. at that 19%. So it's something that we definitely want to keep our eye on because we feel like it's initiation at a different level with a different product. It was staggering whenever we saw the rates go up so much in 2015.
Sure, thanks so much. The next question, someone is interested in learning more about the 24/7 tobacco-free schools policy. Vicki and Jacqueline, can you remind me, is that something that was implemented in Mississippi, or am I confusing you guys with Oklahoma?
I think the 24/7 reference was for Oklahoma, but we do have tobacco-free school zones here in Mississippi. And the policy includes all tobacco products.
Sure, thanks so much. And so, Kristen and Jonathan, can you expand on that 24/7 tobacco-free school policy?
Sure. So essentially what we're looking at is that it's 24/7, so schools have to be tobacco-free, and it doesn't include e-cigarettes currently, so that is what the grantees are working on to make all of those policies even more comprehensive, adding in e-cigarette language to include that in their 24/7. I think, as I briefly mentioned, what made that so successful and how we got it to become a law is that progression of all of the grantees slowly but surely, boots on the ground, working every angle to get those schools on board with passing those policies. I believe that when we got to the end, whenever 24/7, the law was enacted in 2015, we had over 80% of our schools, they all had a tobacco-free policy of some sort. Varying levels of comprehensiveness, but with the law and with the progression and seeing how many of the schools this was important to them, I think really made an impact on the governor and on our leadership, and I think that's how it was pushed through and how it has become so successful. Jonathan, did you want to add in? You actually did the work, so.
Yeah, on the 24/7 policies, like all the Wagner County ones are tobacco-free and vape-free. They are not required by law to be vape-free. But before the state law at a school environment, there could be no tobacco use between the hours of 7 and 4. So if somebody went to a wrestling match or a football game, they were more than welcome to smoke on the grounds if it was before 7 a.m. or after 4 p.m. So that's why we had a lot of work from local grantees to change that and make it a 24/7. I pulled up one of my policies real quick to look at it. And I mean, the policies are very specific because of the questions that you'll get. I mean, it lists pipe tobacco, snuff, chewing tobacco, e-cigarettes, vapor devices, and then depending on the school, sometimes they talked about property that wasn't on the school but was still owned by the school. So, and there's always enforcement included with the policy. There's something in the student handbook, there's something in the faculty handbook, and there's specific enforcement for visitors of the school environment as well.
And to also add, I think what Oklahoma did really well is that we coordinated our policies. And so in the sample policies that we gave out to the schools and to the grantees, of course they still had the opportunity to adapt it and change it, but we gave all of the elements that make it comprehensive, and we tried to streamline that, which I think has been extremely helpful for not only consistency across the board and with the law coming out, but also with when we're trying to track those policies and the elements and see how comprehensive they are. It made it a lot easier for us at a state level.
Great, thanks for expanding on that, and I certainly understand why the need to brand that as 24/7 became a very key aspect of that policy given what was in place prior. We have another question that I think I'll pose to all of the speakers. You all might have different insights here. What kind of tobacco cessation support has been offered to youth in these initiatives that you're presenting about? Did it include support groups? What sort of cessation resources have you provided?
Hey, this is Vicki with Mississippi. As far as tobacco cessation support for our youth, we do not have youth-specific programs, but we do drive those youth to the Mississippi Tobacco Quit Line, where they have a special protocol for spit tobacco. They provide telephone counseling, and they also have an online cessation support treatment program. And we try to promote the online system to our youth and young adults. So with that online system, there's a chat or a peer support component where they can have interaction with those other youth who are in the session, and they also have the ability to blog with their counselors. And the youth follow, if they're 18 or older, they follow the adult protocol as far as nicotine replacement therapy. They can receive the counseling and the NRT, but if they are younger than 18, they have to have parental consent to participate in the counseling sessions, and the NRT is not provided per the manufacturer's recommendation for those under 18.
Well, thank you so much, Vicki. Certainly interesting to hear that Mississippi has in place certain resources specifically for smokeless tobacco use on the quit line. So that's certainly relevant to this whole discussion. I'm wondering if Kristen and Jonasue have anything to add from Oklahoma perspective in terms of tobacco cessation support being offered to youth as part of these various outreach efforts.
So part of the policy elements that we include is that cessation will be promoted mainly to Helpline, similar to Mississippi. I've done a lot of research on cessation and use, and it's from my research, it's very difficult to find the research base for what works best for youth. It's kind of difficult to have your own program or what works best because of the way that the brain develops as compared to adults and even young adults. So I've been doing a lot of research on it, and I would love to expand beyond just the Helpline, but that is primarily what we utilize as well.
All right, perfect. Yeah, thanks for expanding on that from the Oklahoma perspective. The next question that we have, I think also can be addressed by all of our presenters. How are some of your initiatives funded, especially those that include youth? Does that come from grant funding, from state monies, from the county level funding? Interested to hear the state and local perspectives on how this all gets funded.
Hey, this is Vicki. I'm sorry.
No, go ahead.
This is Vicki with Mississippi. For our youth program, all of our funding comes from state funds, and we utilize that money with sub-grantees to work on youth tobacco control initiatives.
This is Kristen from Oklahoma. So as I stated in ours, we have a little bit of a unique situation. The TSET, the Tobacco Settlement Endowment Trust, does fund a large majority of the community work that happens with the grantees. Like theirs is policy focused, and they are trying to expand to youth again, like they had in previous initiatives that have occurred. I think the state is trying to fill the gaps in a lot of the prevention and youth initiatives. As you all probably know, that's often not what people love to fund. It's hard to quantify your outcomes. And so I think the state has used our federal funds to supplement some of those gaps that might be happening for youth initiatives or even prevention initiatives. So we've primarily used federal funds for that. A few of our tobacco tax dollars also have supplemented.
In Wagner County, our students working against tobacco teams, they are funded from the Tobacco Settlement Endowment Trust grant money. That's a part of my budget when I develop it. But our county has been very supportive, and occasionally when there have been some gaps, our county commissioners have approved a little bit of the health department budget to go into that. It wasn't a lot, but they did chip in.
I would also say with Noble County, they have a very active SWAT team. So it is very much led coalition-based and parents and teachers. So I agree with John Sue on that, but can't forget those community partners.
Excellent. Thanks so much, everybody, for your insights there. I do want to give another reminder to everyone attending that we have plenty of time to answer questions. So if you have anything further that's come to mind or any follow-up for anything that we've already addressed thus far, please feel free to go ahead and put those in the chat box, and I'll be sure to direct those to all of our speakers. Our next question is directed specifically at the county level presenters, and so I think I'd like to pose this first to Jacqueline, and then we can get John and Sue's insights on this as well. Participant is wondering what are ways that you have used to get your county manager and commissioners on board with your tobacco policy efforts, and this person is wondering if you have any suggestions when facing resistance from elected officials. So Jacqueline, do you have any insights on that?
I do. On the county level, that's what we want to include and have been successful here with our county board of supervisors. When they know about that and they are educated, sometimes that resistance is lowered, and sometimes we have to be consistent. We have to be vigilant. We have to not only show ourselves when we're trying to pass that policy, we have to show ourselves when we're at the daycare, when they have games, or when they have other events going on in that county. We show our presence there. That has been tremendous in helping when we go to the tables and asking for these different policy amendments or actually developing these different policies, just being in that community and staying consistent with them. For example, in one of our rural areas, Utica has no grocery store. They're just passing a smoke-free ordinance that's comprehensive this year, and that's been a 7-year battle. Another one has been working with a rural county in Edwards, Mississippi. They do not have a grocery store, and they want other things in their community. So working with us, having the smoke-free ordinance, I brought to them some benefits that they could take advantage of from the state level, and also benefits that they can take advantage of with Blue Cross and Blue Shield. That way, that changed the mindset of some of them when I got there to present the smoke-free ordinance, because they were looking at that we're able to gain from this policy. We're not just having another person saying, oh, okay, we're going to do something in your community. It's great to have it. But they were able to find out that this is the person that's going to help and lead and guide us to a healthier county, and also help us with resources in this particular county. So working with those county board of supervisors has been successful, being consistent, being vigilant and visible in that county, and letting them know that there are benefits to have this partnership with us.
Perfect. Thanks so much, Jacqueline. Yeah, that's very, very detailed perspective there. John Sue, do you have anything to add from your experience in Oklahoma?
Well, in our county, we don't have a county manager, but we do have 3 county commissioners. And I have more success dealing with the municipalities because there's more, I don't know if property is the right word, but when you're working with the city, you're able to affect a denser population. The way our commissioners are set up, it's mainly the rural farm areas. So the only thing really that they would control that I would be able to get a policy passed would honestly be like the courthouse. They deal with a lot of rural areas and residential areas where the municipalities have where most of the businesses and the entities and organizations are. So I don't know if I could add so much of the effort with commissioners. Now, when you talk about resistance from elected officials, that happens quite often. I strongly suggest meeting with, be it however your form of government is set up, but like city councilors, when I worked with Porter and with Wagner, I met with each individual counselor on their own because that way I could gauge what their level of knowledge was on the issue, what they needed to know more about, what their objections were. And I did that actually a couple of rounds before I actually went to the council meeting to present something because I was better able to gauge their either support or resistance and be able to tailor my education to what they were needing. As I said in the presentation, I still run into resistance in the city of Coweta, and I am trying to work with more community members and getting statistical information about this is what they want so that I can go back and talk about, you know, this is the percentage of voters in the city of Coweta, because we only take the surveys if you're above 18, that want this type of policy.
Sure, thanks, Jonathan. I appreciate your perspective there, and it sounds like the course of action as far as how to reach out to state elected officials and work with, local officials and work with local government will often depend on how those different governments are structured. So certainly seems to be very much a case-by-case situation there. I'd like to move on to another question. I know, Kristen, that you did mention this briefly in your presentation, so maybe we can hear a bit more from you, but I think all presenters can comment on this. How have you leveraged national initiatives like Through with Chew Week to support your own smokeless tobacco control efforts?
So I think we rely heavily on the grantees to highlight those national events, those national weekly things that happen. I know that a lot of the grantees focus their efforts with, you know, Through with Chew or National Smokeout or even Kick Butts Days. They focus on their communities, and I think what the state does is really try to offer support and help. I think that's the role that we play in trying to organize and provide technical assistance and make sure that a lot of these efforts are happening. And then also what part of the partnership TSET, I think what they do a good job of is really highlighting those efforts that the grantees take on the ground and run with. So we highlight it on forums. We have earned media, and I think TSET does a really good job of making sure all statewide partners are aware of the things that are happening that the grantees actually work on for specific topics such as Through with Chew.
Hey, this is Vicki with Mississippi. I will echo those sentiments. We do pretty much the same thing. Any national efforts that are underway, We receive the information from the national level, and we ensure that our sub-grantees and our statewide partners are aware for any new resources or information that's out there. We make sure that during quarterly meetings or other meetings, we share this information, and we also do email blasts around any national efforts that are going on. And the coalitions at the community level, they are involved by implementing activities in the local communities, and depending on the topic or whatever the issue is of the moment, sometimes, and in some cases, this office will organize a unified activity for all of the coalition directors to participate in, and then other campaigns or information that we share, the coalitions take it and put their own spin on it and create activities based on whatever that national topic is, such as Through with Chew.
Great, thanks, Vicki, and thanks, Kristen, so much for your insights there. The next question we have is again directed to the community level presenters. So I'd like to direct this to Jacqueline and Jonna Sue. How can state health departments best support the needs of the local level health departments in implementing tobacco control initiatives at the community level?
This is Jacqueline from Mississippi. Definitely in joining forces, that has been everything that we do here, because in joining those forces, there may be someone that you find that's over here with disabilities that you need to partner with, or there may be another partner over here with asthma that you need to partner with, or there may be a local hospital that works with lung cancer that you need to partner with. So at the local level, that's our game. That's what we do every day. We're making sure that every partner with every part of that body, we make sure that we partner with them, and at every chance that if they have an event, that we support their efforts as well. As far as with the health departments, definitely, if there's an order from the State Department of Health, those orders are urgent with us. We make those priorities, and we make those right along with our activities that we go out and do, and we implement each and every day.
Oklahoma, I guess, we're a little bit different because of the TSEC grants. I'm at the county health department, and then we have the TSEC grant, which allows us to come up with strategies and action plans based on evidence-based that will direct towards specific issues concerning either, the mantra is eat better, move more, be tobacco free. The state health department, like what Kristen does, is she supplies me with invaluable information and knowledge that it's, I don't have to reinvent the wheel. She can give me the information I need to educate the people on a local level about this is where we're at, this is what we need to do to get better.
Sure, thanks so much, Jacqueline and John, too. I appreciate your perspectives on how that collaboration works differently with your different structures, funding-wise, between the state and the local level. We do have time for one final question, and so I'm going to pose that to all presenters. Someone's wondering if you can describe opportunities for state and local health departments to sustain community clinical linkages that would get health systems on board in supporting tobacco cessation and coverage of tobacco cessation services.
So this is Kristen from the Oklahoma State Department of Health. That's actually my area that I come from, so I actually feel very comfortable talking about the work that we've done. So I think that with tobacco we do a really good job of making sure that we work with those health systems to incorporate sustainable systems change. I think what we've done a really good job of doing is actually embedding in the bidirectional referrals from the EMR to Optum, which is our helpline vendor. I think that we've seen great success with that. We've seen huge increase in electronic referrals, over 100% increase from 15 to 16. And I think for the clinical linkages, that's new for Oklahoma. I think we've been doing it. It's just we're trying to be more strategic in how we do it. So I know this isn't tobacco control, but we're trying to think of ways to expand with obesity and making sure that if we start embedding in systems, what do we have to refer them to? And so I think that's also something that we've noticed with our tribal work and systems, that sometimes they don't like just using the helpline. And they do like having those community things that they can work with on tobacco cessation. So I think it's a new venture for us, but something that we're trying to expand beyond, and I think we're making great strides, especially within our American Indian population, in trying to meet those needs to go beyond just the helpline and just that clinical linkage.
Sure, thanks, Kristen. Does anyone else have something to add?
Hey, this is Vicki with Mississippi. The work that we're doing here in Mississippi is working through our federally qualified health centers and looking at the e-referrals. We just completed an e-referral pilot with one of our FQHCs.
Hey, Vicki, can I ask you a question? Hello?
Vicki, you seem to be dropping off for us on the line. Vicki, are you there? All right, unfortunately, we didn't get to hear the rest of Vicki's answer, and it is time to conclude Q&A and move on so we can finish up our webinar on time. So I do want to take a quick moment to thank all of the attendees for asking those stimulating questions, and then again, thanking all of our presenters for their answers. And so before we do conclude, Megan and I do want to take this opportunity to give everyone an update on the resources we have available online on the NACCHO and ASTHO websites. And so Megan, I'll turn the floor to you.
Thank you. Sorry about that. So if you look at at the side, NACCHO does have a tobacco landing page that has all sorts of resources that local and state health departments can leverage. We also have a toolbox where you can download different resources and toolkits. The publications included on both of those include best practices, fact sheets, toolkits for guiding different evidence-based strategies at the local and the state level. We also recommend looking into the CDC's best practices for comprehensive tobacco control programs at the local level. It's a companion to the CDC's best practices from 2014. It frames local level strategies for recommended program components, and it outlines recommended and minimum funding levels. Thank you, Josh.
Of course, Megan, thank you. And I do want to also direct everyone to this slide where you can get in touch with Megan, her colleague Melanie. They're both very much informed on tobacco and other chronic disease issues at the city and county level. So those are their contact information there. And then I'll take this opportunity also to talk about ASTHO's tobacco resources. ASTHO's tobacco control program serves as a resource on perspectives, capacities, challenges, and opportunities to implement state-based tobacco control and prevention initiatives, and we provide a wide range of materials available on our own tobacco webpage. And if you have any further questions or need assistance on these resources, you can contact myself or my colleagues, Alicia Smith and Talia Sands, and our contact information is right there. I'm also pleased to have this opportunity to highlight a number of recent resources that ASTHO has published available online in the past couple of months. New tobacco case studies and issue briefs available on our website explore North Dakota's engagement of American Indian tribes in tobacco control efforts, how state health departments can coordinate with community partners and property owners to encourage the voluntary adoption of smoke-free policies and multi-unit housing, and also how state health departments can partner with insurance commissioners to improve coverage of tobacco cessation treatments among state insurers. In addition, ASTHO has recently redesigned our e-cigarette resource library to make cigarette fact sheets, journal articles, and other resources searchable and available in a more user-friendly manner. And all of these resources are available on our tobacco webpage, and you'll see the URL at the bottom of your screen. The Tobacco Control Network, or the TCN, is an ASTHO peer network that's comprised of tobacco control program managers and additional tobacco control programs such as Funders Alliance organizations funded by the Master Settlement Agreement, and additional staff from each state, territory, and the District of Columbia. And this wide representation allows TCN to access a wealth of expertise and experience in tobacco control from across the country. And this partnership between TCN and ASTHO provides a valuable linkage to tobacco programs across the nation, and it assists ASTHO in achieving the goals of tobacco prevention and control with an accurate state-level perspective. TCN continues to update its website with new resources aimed specifically at state and territorial level public health and tobacco control. And we invite you to visit their website at www.tobaccocontrolnetwork.org to explore these resources. And new resources available on their website include 3 tobacco policy scans, a series of 8 tobacco success stories, and an ongoing series of tobacco podcasts that explore different topics in tobacco control with state, local, and national experts, along with a state tobacco control program success story template that helps state tobacco control programs communicate their strong work to legislators and other external stakeholders. In addition, the TCN's 2016 Policy Recommendations document is now available online in an interactive format that allows visitors to learn more by viewing call-out boxes with links to additional information found throughout the document. And an interactive state policy map will be coming this spring to the TCN website, and any inquiries related to the TCN and its resources can be directed to tcn@astho.org. And as we wrap up shortly, I would like to remind everyone that you will be directed to a survey at the conclusion of this webinar. A link to this evaluation survey will also be made available to you via follow-up email later this week. Please take a few minutes to complete the survey, as it does provide ASTHO and NACCHO with very helpful information that allows us to convene better webinars and virtual convenings in the future. And so with that, I would like to conclude today's webinar. Myself and Megan at NACCHO would like to thank all of today's speakers and all of our staff at our respective organizations who helped to prepare the information shared on today's webinar. A recording of today's webinar, again, will be made available on our website within the next couple weeks at the web addresses that you see on screen, and we will also be sending those out via email soon. If you have any follow-up questions about today's webinar, please contact the teams at ASTHO and NACCHO with our email addresses that you see on screen. Thank you so much for joining us, and enjoy the rest of your day.